Patient safety is my job. I have a personal mission to contribute to the culture of safety by helping patients, advocates, consumers learn how to be key players in their healthcare when they're consuming healthcare services. And I have some stories of medical errors of my own, and one in particular is when my mom was in the intensive care. I went to see her one particular evening, and she was laying in bed. She wasn't really coherent, and I just, being my nosy usual self, I looked at the IV pole, and I noticed that an antibiotic that was hanging for her did not have her name on it. It had someone else's name on it and a different room number. So I went out to the nurse's station, and I said, you know, hey, listen, there's this bag hanging, it's running, and it has someone else's name on it. It's for the person next door. She's like, oh, really? So she comes in the room. She's like, well, is she allergic to this particular drug? I said, no. She said, well, it'll be okay. I was so alarmed. That mortified me because the 5 rights of medication administration just kind of out of the window. So I think it is important for medical students, in order for them to be effectively prepared, you need to keep patient safety top of mind at all times throughout your career. And one of the main ways to do that is to use 2 patient identifiers. And it can be 2 of 3 things: the name, medical record, or date of birth. Try to use at least 2 of those each time you access the electronic medical record. When you go to act on a critical action value, if someone calls you, make sure that you write down the patient's name and their medical record number so that you're clear on who you're creating orders for to respond to that value. And when you're collecting and labeling specimens, it's really important that if you have access to barcode verification to scan their wristband, that you use that and not skip over that step as a workaround. And if you happen to make a mistake, admit the mistake. Start contributing and embracing the culture of safety. I know it's really difficult. No one wants to get in trouble and own up to their mistakes. But the idea is that it should not be punitive, because there's probably something wrong with the system. It's a system error that needs to be corrected. And what you can do as medical students and as future medical doctors and healthcare professionals is be a champion for patient safety. You can do that on your own service or at the institutional level. And you should know the policies and procedures for your institution and understand why they exist. A lot of times people frown at policies because it takes away from them being efficient. But when you understand the why, it helps you understand why it's important for that patient's safety. I'm a big fan of patient engagement, getting them involved in their own care. So you'll want to mobilize your patients and welcome them as a valued member of the healthcare team. And then you want to activate your patients. You can assign them tasks. They can be the eyes and ears of safety in the hospital. They can watch out for hand washing, make sure they're observing everyone washing their hands when they come into the room. They can help with patient identification, make sure that before someone administers medication that they're checking their wristband. If the patient isn't coherent enough to do it themselves, if their advocate is there, that's something that they can participate in. It's a good thing to get the patient and their family involved. Find balance. We know that the #1 goal when you go to work each day is to take care of your patient. And time is precious and it's a limited resource. But balance safety and efficiency, because we know that everyone needs to be efficient because there are so many tasks on your plate each day that you're trying to juggle. But add in